Hello, everyone, and welcome to today's discussion on the global gag rule, where we've been and where we're going. Thank you for taking the time to join us. My name is Seema Jalan. I am the Executive Director of the Universal Access Project at the United Nations Foundation, and we work on sexual and reproductive health rights and justice. And as part of what we do, we host and convene an innovative community of philanthropists through a pooled fund to resource the best-in-class advocacy on US foreign policy and sexual and reproductive health rights and justice. And I'm delighted to welcome you here today for this important topic in partnership with Rachel's Network and Planned Parenthood Global to hear firsthand real-time updates from the leading advocates on just the enormous opportunity and the incredible challenge of finding a permanent end to the longstanding, incredibly harmful policy we all know as the global gag rule. And if you're joining us here today, chances are you know how destructive this policy is, and you are excited about a permanent solution. And so that will be the focus for our conversation today. And I want to start by acknowledging that it's been a long road and there is fatigue. We've been fighting this since the Reagan administration more than 30 years ago, but there are really important reasons we keep going and focusing on ending the global gag rule. The first is that the partners around the world are calling on us in the United States to end the global gag rule and to prioritize this. The US is the only country in the entire world that works to undermine bodily autonomy through its foreign policy, knowing that US foreign policy has an outsized impact on the health and rights of people everywhere. Second, it is due to the work of the advocates over time that has gotten us to a point where we have the opportunity, a once-in-a-generation opportunity for a permanent solution. And here's where I want to make a distinction. In one of its first acts in office, the Biden administration did rescind the global gag rule. And this was really significant. It was important and necessary. But this could change with any new president, which is why we refer to the global gag rule as a political football. Without a permanent legislative repeal by Congress, this policy can be reenacted at the whim of any US president. And so we'll hear today that we're really closer than ever to a legislative repeal, and it will still be extraordinarily difficult to do. The path is extremely narrow. And so this is urgent, and we cannot miss this opportunity. The third and the final is that this is even more important in the context of the pandemic, what's happening with our climate and the climate crisis, and domestically in the US context. A policy that further deprives people of access to healthcare by shuttering clinics and making it even harder for someone to make the best decisions for themselves, their health, their family, their futures, is directly contributing to these seismic issues, and it impacts all of us, and the US is not immune to these global issues. So we'll discuss all of this and more today. And on that note, I'm really pleased to introduce our speakers. We're thrilled to have welcome remarks from Fern Shepard, president of Rachel's Network, a community of women funders at the intersection of environmental advocacy, philanthropy, and leadership. And then we have an incredible panel of experts who have really been at the forefront of fighting the global gag rule and advocating for people's health, livelihoods, and wellness everywhere, including Caitlyn Horrigan, Director for Global Advocacy, Planned Parenthood Federation of America, Kareem Paul, Global Health Policy Advocate at CARE USA, Narima Were, Deputy Executive Director, the Kenya Legal and Ethical Issues Network on HIV and AIDS, and Tara Demont, Director for Gender, Sexuality, and Identity at Amnesty International US. Just the last few notes, we will absolutely have time for question and answer with our audience and discussion at the end. Please use the Q&A function. So if you have any comments or a question, please submit with your name and organization in the Q&A box. And please note that this webinar is being recorded. So with that, Fern, I'm pleased to give the floor to you.
Thank you, Seema, and welcome everyone. I'm heartened to see so many of you joining us today. This is an important moment, as Seema has said. I'm Fern Shepard, and I'm president of Rachel's Network. And Seema did a wonderful job saying what we are about. And you may be wondering, Rachel's Network, who is Rachel? Well, it's Rachel Carson, and I'm bringing her up today because so much of Rachel Carson is actually relevant to this discussion. So what's the connection between Rachel Carson and the global gag rule? Well, let's start with the fact that she spent most of her career as a government scientist. And what she believed was that policy should be grounded in science, not ideology, and not in ignorance. And the global gag rule is an example of a policy that is not grounded in science or in medicine or effective healthcare. It was backwards and unjust and counterproductive and ideologically based when it was first put in place in 1984. And as we end the 21st year of the 21st century, it is time to be done with this for good. And that's why we're here. So what else about Rachel Carson? Well, she believed that in nature, nothing exists alone. And we understand that from the ways in which our climates are connected around the world by the actions of others outside of our country. But it's also relevant when you think about the advocacy that's happening right now. This is an all hands on deck moment. This is not a moment that we leave to the women who spend their days focused on global health and advocacy in our country. This is a moment when the environmental community needs to join hands with these women together in the human rights community and anyone really who cares about our foreign policy and the repercussions that it has beyond our borders and reverberating back to all of us. This is the moment we all need to be in this. And finally, Rachel Carson was an incredibly courageous woman who stood up by herself to speak the truth to power. We all have this power, and whether we can contribute our time or our talent or our voices or our resources or our connections to members of Congress, this is the point of time in which we all need to act. So I'm thrilled you're here. We're going to learn a lot about what we can do and what needs to be done. I encourage you to support everyone who is speaking here in their organizations because they're on the ground doing the work. So with that, Seema, let me pass it back to you. Thank you so much for partnering with us and allowing us to be a part of this as well. Thank you.
Thank you so much, Fern. I'm already so inspired by what you shared and about Rachel's vision. And we're really grateful that the Rachel's Network is prioritizing global and sexual and reproductive health rights and justice as part of your broad portfolio. So thank you so much, Fern, for taking the time to join us. Let's move to our panel. So I invite our panel to put your videos on, and so that we can start with our first question. And as Fern put it, we're in an extraordinary moment right now to permanently end the global gag rule. So I want to start with an opening question for each of the panelists on just how did we get here? What is it going to take to actually get over the finish line? And how does this relate to the broader foreign policy agenda? It doesn't exist in a silo, just on women's health and women's bodies. So Caitlyn, could we start with you?
Sure. Thanks, Seema. Well, just to say, I think this moment is truly decades in the making. Really, since the inception of the global gag rule in 1984, folks have been out there documenting the harm, telling their stories, and fighting back, whether it's in the streets, in the halls of Congress, and in the courts. And that certainly has been true for Planned Parenthood Global, where this has been a core advocacy priority for us since its beginning. I think reflecting on the failure to get permanent repeal done in the early years of the Obama administration, where we had a similar window where there was aligned party control of the White House and Congress, in the last 4 years under the Trump administration, we've really worked hard to expand and diversify our support, both in Congress and in the coalition, which has really brought us to the moment that we're in today. And I think when you look at this moment, what we see is unprecedented support in so many measures of the issue. And as Seema said, there is a narrow but serious path to get this done this year. So looking at Congress, we have the Global HER Act, which is a standalone bill which would permanently repeal the global gag rule. And in the House, it's supported by 192 members of Congress. And I remember when I first started working on this issue more than a decade ago, it was a big deal when we hit the 100 mark. So in that time, we've nearly doubled our support. Turning to the Senate, we see a bipartisan majority of support in the Senate, which is truly remarkable. And for anyone who has followed the news, you know it's hard enough to cobble together the full Democratic caucus, let alone get bipartisan support. And this really does stand out as a unique support for a reproductive health issue, domestic or global, in this Congress. In terms of the coalition landscape, we see over 150 diverse US organizations who have endorsed the Global HER Act, and globally over 200 organizations spanning 88 countries across 6 continents calling for an urgent end to the global gag rule. And even looking at the American public, we see 70% of Americans support ending the global gag rule. So this year and the coming month is really our best shot to get it done. And that's because Congress has to act to pass funding bills. And the House has already included language to permanently repeal the global gag rule in its version of the bill, which has already passed the full House. And in the Senate, identical language has been introduced in their version of the bill. So we've been really working hard to make sure our policymakers and especially congressional leadership feel 2 key things about permanent repeal. One is that it's urgent. As Seema said, the work is not done simply because Biden rescinded the policy. And 2 is that it's winnable. And I say that because I think it's a mentality shift after years of sort of the win being incremental progress or maintaining the status quo. This is an opportunity to actually make progress. But we know progress in repro health and rights is never easy. It's always hard fought. And so we're really pushing from all sides. And I think you'll hear from folks about media, about grassroots, about traditional lobbying. And we were pleased to see recently that the White House weighed in support of permanent repeal and made it a highlight as a commitment in their newly released gender strategy. And that's important because it's going to take all sides to make it happen. But we've never been so close. And this is the year that I really think we can get it done.
It's really exciting. Thank you, Caitlyn, for sharing that. And Kareem, what would you like to add?
Yeah, thanks, Seema. So at CARE, when we do our advocacy, we really try to take a wraparound approach. And I think that's been particularly useful for talking about sexual and reproductive health, rights, and justice. That advocacy has 3 main parts. One, it's staff like me or CARE leadership who are meeting with policymakers from across the aisle in DC to present policy solutions or give background based on what we're seeing from CARE partners across the world. But I think the second 2 is what makes us really unique. We have about 200,000 constituent advocates in districts across the US, from South Florida to like the most remote parts of Alaska and everywhere in between. All these people who with CARE are ready and willing to do petitions and social media and meetings with their members in district to talk about a range of issues that CARE works on, but including family planning. Our constituent advocate network has been talking to their members of Congress about family planning for years. So when the global gag rule is instated, and when it was expanded during the Trump administration, they were already kind of ready and willing to be even more engaged. And we've continued that during the pandemic as well, just switching to virtual meetings. And then the third part of our advocacy is our learning tours. And with those, we have members of Congress, their staff, members of the administration who travel to different parts of the world. And again, now we're doing a little bit of that virtually, but he'll travel to different parts of the world and hear directly from program participants and from our partners who can speak directly to how our US policies are affecting them. And I think all those 3 things are so important because they make these issues less political and more personal. For talking about sexual and reproductive health and for foreign policy generally, it's a lot easier to understand the reality of the issue when you're face to face with a person affected by it. So I think to get permanent repeal done, it'll take more of that, showing policymakers that there's so many people in the US who really care deeply about what's happening and what impact our US policies are having in other parts of the world. And then two, that, making sure that policymakers are really hearing and seeing from people around the world exactly what the impact is.
It's such an important point, Kareem. Thank you. And one thing just to say out loud is that for Planned Parenthood, for CARE, and for Amnesty International USA, you all represent so many activists across the country. And this is something that the average American really cares about. So thank you for putting that as part of the discussion. That's a great segue to Tara. So welcome, Tara, and I'd love to hear your perspective from Amnesty International that works on a broad range of human rights issues.
Yeah, thanks so much. I think there's so many, just everything I just agree with, everything already that's been said by Caitlyn and Kareem, and particularly emphasizing we have this narrow but very real opportunity to finally end this deadly policy. And for our international colleagues and the sort of what is it going to take, it's all the work that's been put in for decades on the ground. And thank you to those shoulders that we stand on and those arms that we link with, and all the work that Caitlyn and Kareem have already talked about. And it's also going to take all of us to make it happen. And I think there's a role for global organizations, as well as obviously the domestic work that's going on. So there's just loads of reasons to oppose the global gag rule. We know many of them. One of them is that it's a massive human rights violation and crisis. And that's certainly Amnesty's sort of key niche, thinking. And everyone, of course, here is committed to those human rights. But one of those things is thinking about how we each in our organizations and our constituencies are within our power. What is the reason and what are the ways in which we approach the global gag to help make people understand why it is a problem? And I think, Kareem, you said it so well, which is some of that is going to be understanding directly, here's what it means when you tell a person's story. Here's what it means when this is in place. And I think for those of us who are in the sort of policy world, as I adjust my glasses, who really love to think about policy, that doesn't always translate. And so making sure that we're communicating what the real impact is for real people and not the policy, sort of intricacies, which are, super interesting and really care about because they really matter, but helping communicate why that matters. And for all of us on the horn today, and for those in this conversation, thinking about the way that internationally, we have to make sure that the United States sees that this is a global issue, that the United States is wildly out of step with the way that progress is happening on the right to abortion. It is wildly out of step with understandings of health care provision and health systems. This is such a no-brainer, does not work for healthcare systems, that it is wildly out of step with governments interfering in other governments' ability to execute healthcare and complete healthcare for their people. That the US is just wildly out of step, and that this policy is so retrogressive and so out of step that it's just an anathema that it still exists. The other, I think, is, again, is not that just this policy damages individual people's lives, which it very much does, but it's damaging for international relations as well. This makes the United States look so bonkers, is the official human rights word, that it's such a joke that the United States has this as policy. And that, I think, is an important perspective that other governments can leverage, and that can be influential, where other arguments like human rights or basic facts may or may not register for some of our listeners or our targets. The other thing I think is really important, this is actually my third webinar today, started about 5 a.m. Eastern time on abortion in the international sphere, is that the international community is hungry to talk about this, and that we are not alone. And this is really important, I think, not just for decision makers in the United States, but for those who are pounding the pavement, those who are providing abortion care within the national context, those who are working to end the global gag in a global context. We are part of a broad human rights movement, and that includes the right to abortion, that includes the right to full reproductive health care, that includes, having the right to determine what happens to your body and ending global gag. And that we are part of this big movement, not only to bolster all of us in very tiring times fighting for decades and decades on this policy, but to remind the decision makers as well that this is no matter what the US's sort of history is thinking like this, we do not live in a bubble. And we are part of this broad movement that is moving forward on this. And the US as a government can get left behind and be an outlier, or it can continue to try and push forward. It certainly, as we know, the United States likes to see itself as a leader, and that this is not global leadership. So I think that those are all really helpful contexts when thinking about all the ways that we can interact with that. And it really is the work of getting to the specific and very intricate political moment that can feel very esoteric, like we have to do these very specific things, which is absolutely true. But those big takeaways are that we are driving this progress forward. Like progress is coming, and the United States is just in the dark ages on this, and really reshifting that debate. And I think that it was Caitlyn or maybe even also Kareem that noted, maybe it was even Seema, that 70% of Americans support the right to abortion in the United States. 70% of Americans support ending the global gag rule. This is not actually a controversial issue, and reframing that debate and taking back the power of being on the winning and majority side. Mm-hmm. If it was a minority issue, we would still fight for it because it is still a right to have access to abortion, but it is not. We are in the majority here. This is an absolute majority of people who think this is a dumb policy. It absolutely is. People agree with that, and we can build on that power. And remember that though the political power is lean, that we are in a position of, certainly I believe, moral power, but we are in a position of real people power here as well.
Absolutely. Absolutely. Thank you so much, Tara. And I want to just add a finer point to something that you said, which is the capacity of groups to actually navigate the intricacy of policy and government to end this and get to permanent repeal is really significant. It's part of the work. And we're really focusing the conversation of like, how do you really get this done? That takes really explicit and expert knowledge. And there's only like a handful of groups who can really do it well. And so I want to now turn to Narima, who is also a policy and legal wonk and, navigating this from the context of Kenya, which is one of the countries most impacted by the global gag rule. So Narima, tell us more what this looked like from your end and the point that we're at right now in finding a permanent solution.
Thank you. And thank you for everyone. I think I'll just be adding to everybody's contribution. I would say significantly was the cross-learning. I don't think we had appreciated as much how necessary it was for everybody to appreciate and unpack the global gag rule within their own context and be able to localize it. And that had been lost, I think, in previous iterations, and it became very important in this iteration of the gag rule only because of how expansive it was. And then that level of cross-learning that meant that we had a lot of partnership with the US-based organizations who could then give us real-time updates on this is a rule now, this is what it means, these were the amendments before that actually impact you, and then this is how you need to understand them. So then that level of understanding was important. And the next level was then how does this affect your own local policy and your own local laws? So for instance, for us in Kenya, significantly, it completely undermines our own constitution in the sense that we have abortion in our constitution and it's actually guaranteed for more than life. It's guaranteed for health, and it's also guaranteed for instances such as rape, based on jurisprudence around abortion in Kenya. So then that would then require us considering if we're undermining our own constitution based on a contract, how are we going to do this? How do we navigate the space? Because it was going to be based on a contract. And then also trying to learn not just from other Kenyan organizations, but from organizations across the continent about how the different iterations are happening within their different jurisdictions. So South Africa had a different experience, Uganda may have had a different experience, and that ability to then convene and discuss this and be able to appreciate then what do we understand, what does that mean for us, and how do we now move going forward to ensure that we are trying to work towards guaranteeing a repeal. So we had a lot of evidence building that we needed to do in terms of what was happening on the ground, but then additionally, how then it impacted our individual countries' jurisdictions and how it undermined our own laws. And then the next thing I would note is that having that appreciation was understanding then it was very cross movement and we needed to move across the movements. I think everyone's mentioned this before me in the sense that it wasn't just SRHR, it wasn't just reproductive justice. The expansion to PEPFAR significantly fractured our health system, because it's it is the largest provider for HIV treatment in Kenya. And so expanding it then meant that the health system would be factored in how services were being delivered. And if you cater for 70% of our ARV medication and you want to determine how that can be given, by whom it can be given, and what else they can't give, and people then have to make the decision, do I take this money, do I leave it? Or if I take it, what else am I removing from my service package? So being able to understand what the expansion meant, and then the leap into the global fund starting to adopt some of the global gag language was where then we really did see a shift from, it's not just a reproductive justice issue, other movements, governance movements, human rights organizations needed to be very keenly involved because it was a sovereignty question, it was a human rights question as well as a human rights question, but most significantly, women and girls were deeply impacted by this rule. And my time is up.
Well, thank you so much, Narima. And just for folks who may not be familiar, PEPFAR is the US government's global, it's the president's emergency plan for AIDS relief. And you just put such an incredibly insightful point on it, which is the US is providing all this funding for HIV/AIDS, prevention, transmission, and care. And global gag rule then applied to that in the context of the Trump administration, just like how expansive and how insidious and deep the impacts were. But I actually want to stay with you, Narima, for the next question, which is, you obviously are explaining kind of to American advocates how this played out in the context of Kenya. Like, what is your recommendation to those working and living in the US? What would a permanent repeal mean for your work and the communities that your organization works with?
I think a permanent repeal would firstly rebuild the trust in global health assistance. I think in the last 4 years, the trust in global health assistance has deteriorated quite significantly. And while many countries do want to move towards being able to cater for their own health resources, we do still have a significant gap in terms of income equality resource equality across the globe that we can't ignore. And global health assistance is supposed to actually help kind of breach this gap, but not in the way that it has in the past, and not with this rule. So permanent repeal would mean just rebuilding the trust between the nations. Secondly, and significantly, we would then be able to see governments stepping up to the plate when it comes to reproductive rights. This has emboldened many opposition, even within governments, in the sense that people who already oppose access to abortion have been emboldened by the position that the US has taken. And even when there's an obligation to provide abortion in certain jurisdictions, we've seen people clawing back on that based on some of these decisions being taken abroad. So just being able to then have a platform that allows governments to just step up to the plate of what's necessary and hold them to their obligations as they're required to, both international law, regional law, and many of the laws. And then finally, for women and girls, access to services. Like, there were communities whereby maternity services was a whole disrupted because of the choice between taking the money and leaving it and not having abortion services. And you'd have women have to travel 10 kilometers more just to access skilled birth attendants. So just the access to services question for many women and girls, this has affected maternal mortality, access to abortion, access to contraceptives, just a number of myriad of things that have been affected, including HIV services. And this will be such a huge thing for us in terms of being able to integrate our services and actually ensure quality service delivery at a one-stop shop for women and girls across the board.
Yeah, at the end of the day, it's about health services for people. So thank you so much, Narima. I'm going to turn to Kareem because, it's very real what's happening with the global pandemic and COVID. And I know for CARE, you help lead the advocacy work related on sexual and reproductive health and rights, as well as on international COVID relief. So how has COVID exacerbated the specific harm and destruction of the global gag rule? And how can, having a permanent solution potentially also support some of the solutions we're seeking for resilience in the context of a pandemic?
Yeah, and I think my answer actually follows nicely with Narima's comments, because in so many ways, COVID really exposed and exaggerated a lot of existing problems in health systems, including by really disrupting health services and access to health services. COVID limited the capacity of health facilities, it overstretched health budgets, it overworked healthcare providers, and it really just engulfed a lot of the health services that were available in so many places. And we knew anecdotally that a lot of the movement restrictions and the extra burdens of COVID would be felt most by women, but we're actually seeing more and more proof of that as time goes on. There's emerging research that's showing that in a number of low-income countries, actually twice as many women and children are dying from disruptions in health services caused by the pandemic as they are from the COVID virus itself. So overall, COVID is just making it a lot more difficult for people to get full health access. And the global gag rule, when it's instated, it adds another layer of difficulty, again, particularly for women seeking healthcare. People don't stop being pregnant or getting pregnant or not wanting to get pregnant just because there's a virus out there. So having full access to reproductive health services, I think it really has to remain a priority, even during crises, and maybe even more so during crises like COVID. So when the global gag rule is instated, again, it significantly restricts health services, which is of course difficult for folks seeking reproductive health care. But even beyond that, the funding that gets threatened by this policy being in place, that funding pays for salaries and it keeps the lights on in facilities that provide a number of routine health services and emergency health services in communities. So, with COVID in particular, oftentimes doctors and nurses who work on a whole range of issues were pulled into COVID response. So if a clinic is short-staffed because they lost funding or because they reduced their reproductive healthcare unit, now those professionals are not going to be there ready to respond when another health emergency arrives, including something like a pandemic. And the global gag rule also in itself, it prevents providers from giving their patients the full range of options and services that should be available to them. And if patients can't be sure that their health providers are giving them that full information about all their options, it really breaks down the trust between, health systems and the communities they operate in, similar to what Nareema just said. So if I know my doctor is not telling me like full unbiased information about my pregnancy, like why should I trust them to tell me full unbiased information about COVID, about like a new type of virus or about anything else? And for COVID response in particular, we've seen time and time again that trust has been so important. The health workers are the ones that were first telling people about this virus. And now that we have the vaccine, like health workers have been the best able to increase confidence in the vaccine and answer questions. But again, if that trust is not there, it makes it just all the more difficult. And lastly, I'd just say that, women make up 70% of health workforces. And we know that women tend to be primary caregivers, even if that's not their profession. So responding to COVID and repealing global gag really go hand in hand if we want to save the most amount of lives.
Thank you so much, Kareem. Like healthcare is healthcare and this is healthcare. And thank you so much for kind of unpacking the layers there. So Tara, I'm going to come back to you and switch gears a little bit around, Amnesty International and Amnesty International US is such a large grassroots organization. Take us back to sort of like what individuals can do to support a permanent repeal. Many people have said like, this is the moment, it's all hands on deck. I know Fern mentioned that. How give us advice. What do we do as individuals? A lot of us work in our professional capacity, but what do we also do as individuals?
Yeah. So everything you can, there's loads of things. One is like whatever resource that you have that you can give to this. Now is the time. This is the moment. It's always been the moment. And this is really, really the moment. If you're an individual in the United States with voting representation in Congress, which means if you're not from the District of Columbia, Puerto Rico, Guam, but if you are in the US and you have voting representation, you need to be reaching out to them on this. Even if they already voted for this in the House, right? They need to know that this is your top priority. This is particularly true for your senators. You should be reaching out to your senators and talking very brief, like be brief, be accurate, be courteous, right? The ABCs of lobbying, but call your senators and let them know that repealing global gag is your priority. And it's not enough that they would vote for it if it came on the floor, because that's not how legislation's working these days, that they have to fight through whatever avenue to end global gag. It is urgent and it is possible. We can win this. This can be a a win for everybody who cares about human rights, for those legislators who want a win. This can be a win. It is urgent and possible. So if you have voting representation, please, please, please be calling your senators. Have your mom call her senator. Have everyone you know call their senator. Even if their senator is wildly anti-choice, they need to know that this is a fight they can't win. And that those who are already indicated that they would vote for this eventually, or maybe you're even co-sponsors of Global HER, which would repeal global gag, that you expect them to not just co-sponsor the bill, but to put their butts on the line, if you'll pardon me, and make this happen through whatever means, processes, or, and they get very technical, right, through appropriations, et cetera, that's the way that you expect. In the last 30 seconds here, I am watching the chat, that I would say, if you are then in an organization, that this is a time for you to uplift, or if you're not a US voting citizen, this is a time for you to uplift whatever messaging, whatever support you possibly can. From Amnesty International, that's obviously been a lot of the human rights angle, right? Like, now is the time. We are going to keep talking about this as much as possible. We're going to talk about it in the US press. We're going to talk about it in all the global presses that we can get in, because that matters as well. So no matter what your role is, and if you're an individual who doesn't have an organization globally, write a letter to your paper about it, write a letter to an organization, call the US Embassy about it. There's a load of things, and I can put more in the chat too.
That's perfect, Tara. And I think I'm imagining you would be welcomed by many for any resources, talking points, or if you pick up the phone and call a member, or if there are resources there you can share, that would be fantastic. So Caitlyn, I'm going to share a question with Caitlyn, and then get ready for any contributions or questions from our audience here. So Caitlyn, PPFA has been, like, your team has been at the forefront of this for such a long time. And we've all heard about that there's groups from kind of all types of movements. And then Rima talked about it, getting behind this because it violates so many norms and standards and human rights issues. So what are the impacts of the policy in that meta sense? And also sort of what is unique about this particular moment, and I think that's going to be a good segue for moving to our audience.
Thanks, Seema. Well, I think I'll build off what some of my previous panelists said. Certainly we've been living under the shadow of this global gag rule for nearly 40 years. So we really understand the wide-ranging impacts, and they've been well documented. And of course, as many have said, they've only been magnified under the Trump administration's unprecedented expansion. So what our research tells us, and I think this is echoed and reflected by so many others in the field, is really three core findings. One is that the global gag rule has cut off access to a range of health services. So even though you see the policy aimed at abortion, and certainly we see very concrete negative abortion impacts, it also undermines access to contraception, to HIV prevention and testing, and to maternal health services. The second, and I think you heard this from Narima, is that it really stifles local advocacy efforts. And we see longstanding partnerships broken up because organizations have to choose to either comply with the policy or to refuse and give up funding. And the impact is really beyond, I think, just US funded partnerships. We saw examples out of Uganda, for example, where national level coalitions tackling big challenges like maternal mortality really were fractured because of fear and distrust as a result of the global gag rule and forcing organizations to choose a side. And then the third, we've seen the global gag rule really embolden those working on an anti-rights agenda. And Tara, I think, will know well that these anti-rights movements cut across so many issues. And we see opposition groups in many countries feel really empowered to try even bolder actions in their country settings because they feel that both the policy and in turn the US government is on their side. So the policy and the destructive cycle of it turning on and off has really created this fear and confusion, and ultimately put services out of reach for communities who, as Kareem has said, already face numerous barriers to care, only magnified under COVID, including women, young people, and LGBT. So I'll conclude just by saying that, unfortunately, I think it's quite clear that these harms also don't end when the policy is temporarily paused, which is why we see so many organizations and policymakers coming together at this moment now to demand permanent repeal. And I think, the uniting factor is that these organizations and policymakers understand that it builds off Biden's actions, yes, but that would be a monumental step forward for global health, for human rights, and for gender equality to get this done.
Well, thank you, Caitlin. Like you said, we have this incredible opportunity, but it's still going to be such a mountain to climb. And I think I'm going to end up staying with you because there's a question in the chat about the upcoming Supreme Court decisions in the context of the United States and access to abortion. Does that interfere with this effort in any way? And everyone's welcome to weigh in, but I know that this is something that Planned Parenthood is also working on.
Yeah, well, I don't think it directly interferes, although certainly we know that decisions in one place can have a motivating or chilling impact in other places. And I think progress can be inspiring and motivating to replicate, but also, regression also is replicated in other places. So in that way, I think there's an impact. I think there's also a real lesson learned on being more proactive and getting out of this defensive mode so that we're not in the crisis that we find ourselves in the US, where our rights are really on the line and so vulnerable. And so ending something like the global gag rule is really trying to get ahead and creating this enabling environment where sexual and reproductive health and rights can flourish in new and unprecedented ways around the world. And I welcome other colleagues weighing in on this question.
Yeah, if it's okay, I'd just add that, I think the fact that we're sometimes still working on protecting these rights domestically shows why permanent repeal is so important. It's not just an on and off switch for the global gag rule. So even when a new administration takes over and they might repeal the global gag through executive order, it takes sometimes years for those programming changes to take effect. In our own programs in Bangladesh, there were care partners who in 2020 were still having confusion about how to apply this rule. So it's just a couple months later and there's a new president and things change again. So I think it's just more reason why permanent repeal is necessary, so that can be taken care of, even if things continue to change or be in flux in the US, that it won't keep having to impact programs internationally.
That's such an important point, Kareem. And I actually would love for Narima to expand upon that a little bit, just sort of like why it's so destructive that it's this like ping pong, like any US administration, the president can just change their mind. Even if we have, in the context of right now, the Biden administration did rescind the policy, like why is it still this big issue that around the corner, it could come right back?
Well, I think, the main thing is because so many of the countries affected by it are very dependent on global health assistance, particularly US assistance. And it is one of the largest funders of global health. So it's hard to ignore that aspect. And then the next thing is the fact that you can, by way of contracts, completely undermine local jurisdiction and local jurisprudence, local laws, and decide for purposes of this, we don't care what your legislators say, what your courts say, it doesn't matter. You sign the contract, we move with how you sign. So it's very disruptive. And also what Kareem has just said is that it takes on average 2 years to get out of it, get through the contracting changes, get through the understanding of a new system, of a new president's position. And the president's term is 4 years. So then you only have about 2 years, and you don't know what's going to happen in another 4 years. And then the sense that when this happens consistently without any full understanding, and you have no control over it. And this is within the context of the fact that we can't ignore the fact that we have a lot of historical inequalities that have led to the fact that we need global health assistance. And these things cannot change by themselves. The fact that we have just come through we are still in the middle of a global pandemic should be enough to let us understand these public health crises will not just affect one country, will continue to affect the whole world if we don't find ways to work collaboratively and collectively in addressing these issues. And abortion is a public health crisis for many countries. Kenya, for one, it's a huge public health crisis. We have more deaths as a result of abortion, more deaths as a result of unsafe abortion, because of a lack of policy framework to protect women and girls from it. In the sense that if we continue to act like it's not going to go away by itself. The US was able to invest in HIV because there was definitely a correlation with a communicable disease. The idea that because it's not communicable, because it only affects women, because it only affects girls, we can ignore it and act like it's not a crisis is really where we see the disparity in where women still are in the world.
Yeah, why should women's health always be a football, everywhere in the world? So thank you, Narima. Oh, and I want to connect to Tara with a question. Since Amnesty International is a multi-issue organization, you work on a lot of human rights priorities, is how do you get, in the US context, congressional leaders to prioritize this when there's so much our country in the US, again, is dealing with? Obviously, we just saw all of the news around domestic priorities. How do we get this, like you said, to make sure that every member of Congress knows that this is the moment, this is the time to put the chit on this versus something else?
Yeah, well, I mean, I will say that I don't think the human rights argument is the compelling argument for potentially for US Congress members. So it's not like finally they realize it's a human rights to which they've always been committed, right? Because that's not actually super compelling to everyone in power, which is part of our job, and unfortunately part of the reason that I have a job. But I do think that they do need to hear from their constituents, and what can move that center of power is, I mean, the human rights argument we're going to make because that's the winning argument. That's what we need in the long run, not because it's politically popular, not because you like it or you dislike it, because it is a human right, because that's ultimately what's going to shield us all in the long run and really create that positive space where we can enjoy the fullness of our human rights, including the right to abortion. And that, as Caitlyn noted, and as you asked, Seema, like that's whether or not it's a tax on that right globally with US dollars, or a tax that we're seeing in the Supreme Court on US folks within the US. Those are connected. What is likely to make this happen politically is showing the massive power and movement that this is urgent and this is possible. And as your voting constituent, I expect you to prioritize this, that this can't be seen as a niche issue. And I do think there's then global benefit of having our non-US constituents show that support, even though please don't call our Congress people. But like that is really important. Like, this is not a niche issue. This is not some like really wonky foreign policy issue. This is a basic human rights priority. I expect this to be your number one thing, because there are loads of human rights priorities, right? There are lots of things the US needs to be doing a lot better, and lots of things they just need to stop doing in terms of massive human rights violations. But this can get lost in that conversation because there's so many things. It's a very easy out for then policymakers to be like, I'm doing so many things. It's like, well, that's your job, and I believe in you. This has a pathway forward. We can do this. We are part of the righteous struggle for all these other things. We are in intersectional sisterhood and siblinghood with all these other issues, and we can do this. And by doing this, we are going to move every boat will rise if we can move this. So I think that's really key, is that decision makers need to know that this has to be a policy priority. It can't be just, if it's one of the many things we could get to, because there are many massive moral issues that are just as important. Like no human rights issue is more important than another, but this is connected to all of them, and it can't be seen as the sort of niche I don't want to say stepchild issue, but the issue that's like important only to a niche market. It's not. And decision makers in the US need to see that.
Yeah, as Caitlyn said, it's a winning issue. It's a winning issue. And just one last piece, like a very concrete thing, is like, how much time do we have? Like, what's the decision-making timeline? And Tara, you're welcome to answer that, or if anyone else wants to answer that.
I can kick it to Caitlyn only so she can say a smarter version if it's hard to tell. So because of the way that if folks aren't very involved with the US congressional system here, take me to your leader. I want to live that life. If this were a bill, we'd have a sort of certain calendar, like this is on an appropriations calendar, which used to have a specific calendar, and now it seems to run all year long. But we are right now in the moment where leadership in the parties, and particularly the Democratic Party, who has traditionally been the party that's going to champion this issue, that they are making decisions around what to really fight for when the deadline comes, which is going to get kicked back once or twice. But like, when the deadline comes, what are they going to fight for? Those conversations are happening now. The deadline itself is the fiscal year. That will get kicked back, through a continuing resolution, probably till Christmas. I'm so sorry to everyone who works in the government. But right now is the time to have that conversation, because that's when the priority setting is happening. The actual timeline for then when you might see news about it, maybe October, like December, that sort of kicked down, and I'll leave to Caitlyn's more and better insight there. But now is the time to take action. Now is the time to show that urgency. This has to be a priority right now, so that when you go to the table, that could happen at any time that you have that congressional meeting or that member to member meeting, your priority is gag. It is urgent, it is winnable, it has to be the priority.
Yeah, totally agree with everything Tara said, and can just put a finer point on some of the key dates to look ahead to. So the current funding expires on December 3rd. So Congress has to take action by that point. So we could see the win at that point, or we could see them buy themselves more time to negotiate. Something like the permanent repeal of the global gag rule is included in both bills, so really should be non-negotiable, but we know the political reality of how our issues are treated. So in reality, it will probably be one of the last things that are negotiated, which is both stressful as an advocate, but on the positive side, gives us the maximum amount of time to weigh in on this process. And really, as Tara was saying, make our voice heard. And this is a non-negotiable demand that there's so much weight and expectation behind. We do know that these decisions are made by a small set of actors. So yes, tell any and all Congress member that you can have, but I think especially leadership and those who lead the appropriations committees will be the final decision makers. So really channeling energy up to the top will be so key in the next couple of weeks.
Right, like we can't rely on the fact that there's so much in favor of this, because we have to make sure it's not traded away. That's kind of the linchpin, right? That it's not traded away for other priorities. It's part of the priority package. Thank you so much, Caitlyn. But we're swiftly running out of time because we wanted to have a tight hour conversation. And the one last question, which I think is a good one to end on and have everyone comment on, and I'd welcome your point of view too, Fern, to bring you back into the conversation, is we're talking about gag because it's been such a destructive and long-term policy. We've heard about that, but ending a harmful policy isn't the vision, right? Like we all have a greater vision for what it will mean to realize sexual and reproductive health rights and justice. So I'd love for everyone to comment sort of on your hope for that bigger vision and a hope for a world where, you know, we can move on from gag and make this a part of ancient history. So I'd welcome anyone starting if you're ready.
I'm happy to start. I've been thinking about this since 5 o'clock Eastern time. Like what I'm interested, I mean, I think about this all day long, but particularly today on multiple webinars, there's just a hunger for this. And like the vision I want to see is not just like, oh, finally these bad policies are taken out, but that we're part of an abortion revolution in which people can access the basic healthcare that they need, including abortion care, free from stigma, with security, with safety, with love and support. Like this needs to be part of everyday care without interference from the government, the same way that they don't interfere in a root canal. Like this needs to be part of that. And that revolution, it's here, it exists, and we can be part of that and keep building on that. And what I want, you know, my vision is that the people who have this minority power and the sort of death grip on US policy and abortion realize they're on the losing side, and that we then can enact and build this world that everyone can access that, and not just the sort of fortunate few.
I love that. The government doesn't interfere in a root canal. Thank you so much. Tara, who would like to go next?
I'll jump in really quickly just to say the mission of Rachel's network is to build a healthy and thriving environment and a just environment. And we can't do that with a global gag rule, period. We got to get rid of this. And this is our opportunity. So everybody dig in, support the organizations you see on this screen. They're doing the work, they're the talent, and they're the feet on the ground in Congress and in community. So please, let's do what we can right now to make this happen.
Thank you so much, Fern. It's all the movements need to come together. Thank you so much. Nemo.
So health and human rights for all, I think access to information, access to healthcare service, access to your bodily autonomy, your integrity, the safety of your body, all of that, but just additionally within a world that is more equitable, within a world that is more understanding of the differences of people, and that we're trying to bridge the gap between humanity and not just to further it. And just finally, to have just more global solidarity towards public health crises. We can't keep feeding into these crises and expecting things to change. We can't keep feeding into colonial inequalities that have come about and expecting things to change significantly. And the last thing is just more accountability for states on meeting their obligations, not just the US, but every other state that has been part of this, every other state that has failed to meet its obligations towards its citizens, just more accountability from grassroots level, at UN level, at every level, just more accountability for states to meet their obligations to their citizens, particularly women and girls.
Thank you so much, Narima. I love that vision and I support it. And let's go to Caitlyn, and then Kareem will have the last word.
Thanks. I think for me, on the most basic level, it echoes what so many else have said, but my hope is that all people, no matter where they live, can access the sexual and reproductive health care that they need and really exercise and enjoy their full rights. And it's hard not to be totally humbled by the progress that we've seen in so many diverse countries, including on abortion access. So for me, it's hard to even overestimate what's possible with a united global movement for a global SRHR. And I do see ending the global gag rule as part of what can fully unite our movement and really accelerate sustainable progress and enable us to collectively take on what have been really long-standing, unacceptable global inequalities and really transform the landscape before us. So I'm excited to get it done and do see ending the global gag rule as a huge contribution to getting us there.
Thank you so much, Caitlyn. That's so exciting as a possibility. Kareem, the last word.
Yeah, and for me, in addition to kind of the hope that's in this congressional opportunity, I think my hope is also that we can come out of this pandemic in a better place. Unfortunately, sometimes we humans wait for tragedy to strike to make really big changes. So I hope that as we're getting through this pandemic, that it'll really shine a light on the need for investing in better health systems and expanding access to health services all around the world and for all people. Not to go back to how we did SRHR or how we did health services before COVID, but hopefully to be better after this. And I think especially seeing how critical women are and have been in keeping societies healthy. Again, like women make up the vast majority of health workers who've been responding to the pandemic. They've been taking on the vast majority of burdens during the pandemic. Seeing that is my hope is that we can kind of realize that we also need to give women the care that they need in return. Having more people of all genders like really be able to make informed decisions about their own bodies, like that's just gonna help us all.
Well, thank you so much, everyone on the panel, for taking the time to join us today. Everyone is so busy, and so we really appreciate you coming together to have this dialogue with the community that's tuned in today. And thank you, everyone, for taking the time to tune in. If you want to learn more, or if you have further questions, this group is a resource. We're happy to have you contact the Universal Access Project, and we can put you in touch with the right folks to learn more, to take action. This is the moment. If you have any space to do extra advocacy, this is the moment to weigh in. So thank you. Let's be a part of a historic moment together. This could be completely transformational and set us on our journey for the real vision for all of our sexual and reproductive health and rights and justice. So thank you again. Take care. And we look forward to the next month and finally ending the global gag rule. Thanks, everybody.